Hey guys, welcome back to Rapid Case Challenges Pharmacology. I'm your host, Pharmacist Tyson, and today we've got a smoking cessation case. So let's jump on in. CD is a 30-year-old woman who wants to quit smoking cigarettes. She takes medications for allergic rhinitis, seizures, and chronic pain management. She smokes 15 cigarettes per day. Her provider wants to prescribe Contrave for smoking cessation. What are some potential red flags? So before we jump into those red flags, we need to think about the medication that she is already taking. While we don't know those exact medications, we do know that she is taking medications for allergic rhinitis, which is usually your antihistamines or intranasal steroids. Usually not a lot of interactions there. However, medications used for seizures and chronic pain management typically have quite a few more adverse side effects and drug-drug interactions. So just keep that in the back of the mind as we continue on. Now, Contrave is a brand medication usually used for appetite control. However, first red flag in this case is if you don't know what a medication is, always look it up. And for Contrave, it is a combination of naltrexone and bupropion. Now, bupropion can be used for smoking cessation. It is prescribed for smoking cessation, and naltrexone has been known to help with impulse control, which is why Contrave is really good for appetite control or appetite impulse eating and stuff like that. So while Contrave is not FDA approved for smoking cessation, it does seem like it would be a good additive to help her with smoking cessation. However, in this patient, this brings us to our third red flag. Bupropion lowers seizure threshold, which means that it could induce seizures. And naltrexone is an opioid blocker, meaning that's going to block whatever pain management medications she has, and it can throw the patient into acute opioid withdrawal. So for this patient, one, Contrave is not FDA approved for smoking cessation. It's going to potentially cause more seizures and potentially throw the patient into opioid withdrawal symptoms. So as a clinical evaluation, this medication should not be taken by this patient. Other options for smoking cessation that we could talk to the provider about are nicotine replacement therapies with patches, lozenges, or gum, and these can be found over the counter. There's a few other different options out there, but Contrave should not be used by this patient for this particular reason. Thank you for watching Rapid Case Challenges Pharmacology. If you have any questions, please reach out to me, Pharmacist Tyson. We can talk through this case or any other case. I'm more than happy to help out any way I can. Thank you and have a wonderful day.